So I suppose a bit of background first on where the HIQA project originated from, and I suppose you all know at this stage, last year the Public Health Availability of Defibrillators Bill was introduced in the Seanad, which is currently at committee stage, and in order to inform decision making about issues related to that bill, the Minister for Health requested that HIQA carry out a health technology assessment on public access defibrillation, and per the HTA Directorate in HIQA's normal procedures, the first two things we did were to agree terms of reference for the project with the Department of Health, and also to convene an expert advisory group. And the terms of reference, as you can see there, they're available on the HIQA website as well. We'll put them up here. And they were to review the clinical evidence that's available on the effectiveness of safety of public access defibrillation programs, and to identify the factors that principally affect outcomes. We also want to review and summarise the Irish data on the epidemiology of OHCA, and I think we heard Siobhan's presentation there. We'll be indebted to the OCAR registry, which I think is a fantastic resource in Ireland for that. We also want to get a good idea of the existing availability of AEDs in Ireland, and that's something that's been mentioned by previous speakers as well. And we'll also want to see how a prospective public access defibrillation programme would fit in with the current configuration of EMS services in Ireland. The second part of the project really then is about looking at the economic evaluation of a national public access defibrillation programme. So we'll also look at the cost effectiveness literature that's available internationally and complete a de novo economic analysis based on Irish data to look at the cost effectiveness in the Irish setting, and also the budget impact of competing alternatives for public access defibrillation. I think especially for this project there are potentially wider implications, be they societal, ethical, legal or organisational, of a national programme, so we'll be looking at that as well, and then to combine all that information together to advise on the optimal configuration of an Irish programme. So like I said, we've convened an expert advisory group, and the purpose of that group really is to provide expert advice to aid in the interpretation of the results and the analysis we'll be carrying out, and also to peer review all the outputs of the project, which will be primarily conducted by an evaluation team from within HIQA. So that's the list of all the people on it. I think there's 2 people from the Department of Health, 3 from the HSE or the clinical care programmes, 5 members who are either from professional organisations, charities or patient groups, and 4 people from HIQA. So what will we do then? The first part really is to get a handle, like I said, in the epidemiology of OHCA and the current AED availability. And I think there's a lot of great information that I've become aware of today out there on this, and we'll be contacting people in due course to complete that work. What we're working on at the moment, I suppose, is the review of effectiveness and safety, and that's like a systematic review using the Cochrane methodology, and that is really to pool together all the international evidence on these types of studies to see what the actual effect on the primary outcome of survival to hospital discharge is. And we're some of the way through that at the moment, and there is good evidence out there, but I suppose a lot of it is from descriptive studies, and this is something I think that a lot of people refer to as well. It's the need to carry out methodologically high quality studies to demonstrate what the actual effect of it is. We'll be doing that as well. The third part then is to do the cost effectiveness analysis and a budget impact analysis. And the difference between those two things, for people who aren't that familiar with it, is like the cost effectiveness analysis will give you sort of the value of different competing options, because the remit of our assessment won't be just the public access defibrillation intervention that's specified in the bill. It'll kind of cast its net a bit broader than that and look for any type of intervention for which there's evidence that it works. And some of those may be police or firefighter, first responder programs, or combination programs that involve, you know, a combination of publicly available AEDs and first responder programs. And the cost effectiveness analysis then will look at the likely clinical outputs of those in the Irish setting, and the likely resource use, and see how they stack up against each other in terms of, you know, value, and that would be like the incremental cost of lives saved or using utility measures like quality adjusted life years. Whereas the budget impact then will look at, it's more of an accounting exercise, I suppose, in terms of it'll look at the costs involved in rolling out and sustaining these interventions over the longer term, and the time horizon that we look at over the course of the project will be, you know, the intervention out to the lifespan of the people involved. So it's a longer term assessment. Finally, then there's the ethical, social, organisation or legal implications, and really once the project is started and once the expert group has met and discussed all the relevant issues, we'll be in a much better position to see, you know, which of these are the most important areas to focus in on, because, you know, it depends on the technology you're assessing at any one time, you know, that which of these things is the most important. So that's something that will become apparent over the course of the study. And I think something else that is good to say at this point as well is that, like, it's health technology assessment, but the technology isn't, you know, just like the AED technology. The technology in this case is the program itself. So it's the public access defibrillation program. So we'll be looking at, we won't be specifically examining the performance of devices or anything. It's from a public health level, you know, what the overall impact of a national program would be, and the different configurations that may take. So finally then, the project milestones. Well, we got the request from the Minister late last year. We've convened the expert advisory group. The first meeting of that group is on in 2 weeks' time, and we hope to have a draft report ready by the end of the summer. And unlike some other HTAs that we've done, we felt that for this project especially, it's very important that we enter a period of public consultation once that draft report has been completed, because, you know, it is a topic, I suppose, that there's an awful lot of information and good input we could get out there. Then there were, you know, seats around the table in HIQA that we could invite people onto the expert advisory group. So in order to capture that as fully as possible, we'll be entering at least a 6-week period of public consultation. And I know it's a bit far out into the future, but we'll try and alert people as much as possible before that, so that people can read the draft report, consider it, and give us their feedback before we finalise the report, hopefully towards the end of this year, late November, early December, and submit it to the Minister for his consideration. And I think another important point, kind of a general point on HTA, is that the outputs of our report will constitute advice to the Minister. It won't be the final decision either. So our job really is to bring the best available information together, summarise and synthesise it, and then give that to the department and the Minister to improve decision making. So that's really a quick overview of what we're doing, and, you know, there's lots of information available on the HIQA website, and people are free to contact us at any stage for an update or to give us any information they see fit. And that's it. Thank you.